My name's Christine, and I'm concerned about my 6-year-old daughter, Jenny. About a year ago, Jenny had a babysitter touch her inappropriately when I wasn't home. Ever since, she's been experiencing terrible nightmares about it. Jenny also becomes fearful and starts sweating when a babysitter gets mentioned. I've noticed that Jenny's having difficulty sleeping and concentrating. She's often irritable and has loud outbursts, and she becomes very jumpy in response to loud noises. Her difficulties led me to consult with a clinical psychologist to explore my options to help her.
So it sounds like your family has been dealing with some really heavy stuff, and I think it's really brave that you came here because I know it's hard to talk about and even think that Jenny went through something like that. A lot of what you're describing to me, how she's responding to this trauma, are actually really common reactions that we see among children who've experienced something like what Jenny went through. And we have some really good forms of therapy that can actually really help her cope with this and improve what's been going on for her. In particular, we have one form of therapy called trauma-focused CBT, and it shows that 80% of kids who receive this kind of treatment show improvement after experiencing a trauma, and even improves family functioning. Is that something you want to hear more about?
Yeah, absolutely. I think that'd be really helpful.
Okay. Trauma-focused CBT tends to last 3 to 4 months because it lasts anywhere between 12 and 16 sessions, and we'll meet once a week for about an hour to an hour and a half. The therapy was designed to treat a lot of different kinds of trauma, including domestic violence, sexual assault, sexual abuse, and natural disasters, things like fires, floods, tornadoes, things like that. So I'll meet with you individually, I'll meet with Jenny individually, and we'll also have sessions where the three of us meet to kind of just talk about the thoughts and feelings that you guys are having about what happened. Any questions about any of that?
I guess I'm just kind of wondering what specifically treatment will look like and kind of how it'll help her get over her symptoms.
Yeah, that's a great question. Why don't I go through the different phases of treatment to give you a better idea of what the therapy would look like.
The psychologist told me that the first part of treatment would involve laying the groundwork to help both Jenny and I understand the trauma that happened to her. She said this would include information on sexual abuse, as well as the common reactions on the parts of the victims and their families. Secondly, she introduced a sex education component. She said that based on the nature of the trauma, it would be important for us to give Jenny information on healthy sexuality and body awareness in order to clear up any misunderstandings she might have as a result of the trauma. I was skeptical about this piece at first, but she assured me that my family's values would be emphasized during this piece. Finally, the psychologist told me there would be a risk reduction component. She said that this would involve teaching Jenny about warning signs to avoid high-risk situations in the future. She said this would involve teaching her how to communicate assertively and formulate healthy physical boundaries.
So basically I'll teach Jenny a series of exercises that she can use to help calm herself down when she's feeling overwhelmed and relieve the tension in her body when she feels stressed out. Examples of this include just sort of breathing exercises to kind of control her exhale, muscle relaxation when she's feeling tension in her body, and also a thought-stopping technique. So if she's having negative thoughts about what happened or negative thoughts in general, she can kind of combat those until she's in a better place to process them. So I'll cover these with Jenny, and I'll also go over them with you so you can practice them with her at home. So we also spend a good portion of time in therapy talking about Jenny's emotions. And to do this, we kind of teach her how to identify her emotions and how to talk about them and express them with other people, and to a certain extent how to control them. And this is really important so that then when we do start talking about the actual trauma, she sort of has a toolkit for how to help her cope with her strong emotions. Mm-hmm. And we definitely incorporate parents a lot into this portion of the therapy because we find that it's really important that they're sort of modeling how to cope with emotions positively at home, and also help her reinforce and reinforce in her when she is coping with emotions in a positive way.
No, that sounds really good and really important. I like that this therapy seems like it does quite a bit to safeguard Jenny and her emotions. Are there any other kind of coping techniques that you're going to recommend throughout the course of therapy? The other day, I overheard Jenny saying something to her dad about feeling like the abuse was her fault. And obviously as a parent that's really difficult to hear. But then I just kept worrying about it and thinking about it, and I talked to my friends and I talked to my mom, and they all just told me that, you know, neither of us were thinking about this in a helpful way. But what happened to her was so terrible, I don't know how else to think about it.
Yeah. So what you're describing is actually pretty common for parents and kids who've gone through what you guys have gone through. And it's actually one of the things that we'll talk about in therapy, and we'll kind of help you identify what thoughts you're having about it that might be more inaccurate or unhelpful, and kind of help you reframe it so that you can think about it in a different way to alleviate some of that distress.